Hello, I'm Dr. Rachel Duncan. I'm the clinical lead for the Brighton and Hove Memory Assessment Service, and I'm a GP with a special interest in dementia. You're watching this video as you have been prescribed, or it has been discussed that you might be prescribed, a medication called Donepezil. This video will give you more information about this medication and what to expect.
What is Donepezil used for?
Donepezil is sometimes referred to by the brand name Aricept, and it's a medication that is prescribed to help with Alzheimer's disease, which is causing dementia. It's in a group of drugs known as acetylcholinesterase inhibitors. In terms of how it may work for you as an individual, it's not going to change the process that's going on in your brain that's causing the problems. However, for many people, it can help with symptoms and it can slow down some of the changes that they may be experiencing.
What is the usual dose of Donepezil and how should I take it?
Donepezil is usually prescribed in a dose of either 5 or 10 milligram tablets that you should take once a day at the same time each day. You can take your medicine with water and you can take it with or without food. If you were to read the instructions in the packet that comes with the medication, it normally recommends taking your tablets at night time. However, in the Memory Assessment Service, we normally suggest that people take this medicine in the morning, as this is generally the most convenient time to take it. It'll probably take about 2 weeks for the medication to start to become effective. If you tolerate it and it's suiting you, we normally recommend you take the medication for life.
Is Donepezil addictive and can I stop taking it suddenly?
Donepezil is not an addictive medication. However, if you were to stop it suddenly, you would lose the benefit that you might be getting from taking it. This would mean that it's possible that your symptoms may worsen. This could be within a number of days or within a number of weeks of stopping the medication. If you decide to stop the medicine, please do it slowly under the guidance of a clinician.
What should I do if I forget to take a dose of Donepezil at the right time?
If you forget to take your dose of Donepezil, take another tablet if it's within 12 hours. Do not take twice as much as usual, as you will open yourself up to more risk of side effects.
Will I need any blood or other tests if I am taking Donepezil?
You will not need any blood tests done to monitor your Donepezil. However, at each appointment, you will need to have your pulse checked.
Will Donepezil affect my other medication?
In general, Donepezil doesn't interact with many other medication that you might be taking. There are a couple of medicines that are sometimes used to help with bladder issues, which Donepezil can interact with. If this was to be the case, we might ask your GP to change you to an alternative medication. We also additionally sometimes ask GPs if it's possible to reduce or stop a medication called a beta blocker, which you might be taking for other health purposes. However, if it's not possible to stop these medications, we are normally able to work around this.
Can I drive or cycle while I am taking Donepezil?
In terms of driving or cycling whilst taking Donepezil, it's a good idea to take your first few doses before you do either of these activities to see how the medicine affects you. You need to be a little bit careful as it can sometimes slow down reaction times.
Can I drink alcohol while I am taking Donepezil?
You can drink alcohol whilst taking Donepezil, however, it may make you feel a little bit more sleepy than you would have done previously.
What sort of side effects might I get if I am taking Donepezil?
The good news is that Donepezil is very well tolerated and is unlikely to cause any side effects. In fact, fewer than 1 in 10 people do experience side effects. There's more information about individual side effects that you might experience in our patient information leaflet, which is referenced in this video. If you were to be unlucky and experience some side effects, the most common thing is that these are transient and tend to wear off within about 2 weeks. People tend to describe feeling a bit sick to their stomach, being a little bit off their food, or even having a slightly upset stomach. If this persisted for more than 2 weeks, you should speak to your GP or pharmacist about it. Very, very rarely people can experience an increase in the number of falls or dizziness or sometimes collapses when taking Donepezil. If this was to happen, please seek prompt medical attention. Other side effects that people can occasionally experience include headaches. Again, if this was particularly bad or if it persisted for more than 2 weeks, you should seek some advice from your pharmacist or GP. Another side effect that people sometimes tell us they experience is difficult or disturbing dreams or nightmares. We normally start off recommending that people change the time of day that they take their medicine to see if this resolves the issue. So if you were taking your medicine in the morning, to try taking it at night time or vice versa. If this doesn't resolve the problem and it's impacting in your quality of life, again, seek some further advice from your GP or pharmacist. A very, very rare and seldom seen side effect is to experience a seizure. This is a medical emergency and you would need to seek urgent help if this was to occur.
What should I do if I am running out of Donepezil?
If you are running out of your medication, you should approach your own GP service about issuing a repeat prescription. Your medicine will have been added to your repeat prescription on receipt of the letter from us about the initiation.
Where can I find out more information about Donepezil?
This information is available on our website in the form of a patient information leaflet should you prefer written information. Additionally, your medication will come with a patient information leaflet from the manufacturer which will contain further details. It's a good idea to use these sources of information rather than going onto the internet, as we are certain about the quality of the information. Additionally, it's important never to share your medication with any other person.
For more information, visit our website at memorybrightonhove.org.uk.